Hello and welcome. Today, we're diving into an important topic, monkeypox. We'll cover what you need to know about its symptoms, treatment options, and how to prevent it. Let's get started. Monkeypox is a viral disease that's similar to smallpox but generally less severe. It's caused by the monkeypox virus, which belongs to the same family of viruses as smallpox. So, what are the symptoms of monkeypox? The disease typically starts with flu-like symptoms, which may include 1 fever. A high temperature is often one of the first signs. 2 headache. Many people experience intense headaches. 3 muscle aches, soreness and discomfort in muscles. 4 backache, pain in the lower back. 5 swollen lymph nodes. This is a key distinguishing factor from smallpox. 6 chills and exhaustion. Feeling very cold and unusually tired. After a few days, a rash develops, usually starting on the face and then spreading to other parts of the body. The rash goes through several stages: 1 macules, flat discolored areas; 2 papules, raised bumps; 3 vesicles, small fluid-filled blisters; 4 pustules, pus-filled blisters; 5 scabs. The blisters eventually crust over and form scabs. Now, let's talk about treatment. There is no specific treatment for monkeypox, but supportive care can help manage symptoms. 1 pain relief. Over-the-counter medications like acetaminophen or ibuprofen can help with pain and fever. 2 hydration. Drinking plenty of fluids is crucial to stay hydrated. 3 rest. Ensure plenty of rest to help your body fight the infection. Antiviral medications. In some cases, antiviral drugs like tecovirimat might be used, especially in severe cases or for people at high risk. Preventing monkeypox is key to avoiding infection. Here's how you can protect yourself. Avoid contact. Steer clear of individuals who have symptoms of monkeypox or have been exposed to it. Practice good hygiene. Regular hand washing with soap and water can reduce the risk of infection. Use protective gear. If you're in close contact with someone who has monkeypox, wear protective clothing and a mask. Disinfect surfaces. Regularly clean and disinfect surfaces that may be contaminated. Vaccination. In some cases, smallpox vaccination might offer some protection, though it's not a standard preventive measure for monkeypox. To sum up, monkeypox starts with flu-like symptoms followed by a characteristic rash. While there's no specific treatment, supportive care can help manage the symptoms. Preventing monkeypox involves good hygiene practices, avoiding contact with infected individuals, and using protective gear. Thanks for tuning in. If you found this video helpful, please give it a thumbs up and subscribe for more health-related content. If you have any questions or topics you'd like us to cover, leave a comment below. Stay informed and stay healthy. See you next time.